name is Takoua Boukhris, epidemiologist at Public Health Agency of Canada, working on a Center for Immunization Surveillance and Programs within the agency. My background is as an epidemiologist, and I hold a PhD degree from the University of Montreal in pharmacoepidemiology, options, medication, and public health.
What are the main takeaways from your talk?
Today, I took a stop at summarizing the key message from one of the studies we have actually undertaken using the data stemming from one of surveillance initiatives we have been undertaken at Public Health Agency of Canada, entitled the Vulnerable and Hard to Reach Populations COVID-19 Immunization Coverage Survey, with a focus on results from Indigenous populations. So we looked at results for COVID-19 vaccine coverage among Indigenous populations, as well as we produced disaggregated data by socio-demographic factors for vaccine uptake, as well as we were able to collect data for reasons for vaccinations and reasons for non-vaccination, as well as hesitancy against COVID-19 vaccination. So in terms of COVID-19 vaccine uptake, the key takeaway is that when you look at the data across 2 years, 2023, 2024, we found that there is no change in vaccination coverage among Indigenous over these 2 years. And also the vaccine coverage was higher among non-Indigenous compared to Indigenous people. However, due to lack of statistical power, we didn't find statistical difference. So beside that, when we look at the data by gender for Indigenous, we found that women are more likely to get vaccinated against COVID-19 compared to men plus. I mean men plus, that men, cis men, transgender men, or men with other sexual orientation. Interestingly, also we found that these same patterns across both years for Indigenous and non-Indigenous populations. When we look at also at the data by age groups, we found there is that vaccine coverage is similar across all age groups for Indigenous and non-Indigenous populations. But an exception among Indigenous population. In 2024, we found that vaccine coverage among Indigenous people aged 55 plus are lower compared to their counterparts, non-Indigenous people of the same age group. In terms of reasons for vaccinations, so the top reason that Indigenous people reported is that they want to protect themselves, their household members or family against COVID-19 vaccination. However, for the main reasons for non-vaccinations, we found that concerns about vaccine effectiveness and safety or side effects is the main reason that prevent them to get vaccinated against COVID-19, and it was the same thing reported across both years among Indigenous population. Lastly, we captured the data for vaccine hesitancy, and over both years in 2023 and 2024, we found that vaccine hesitancy was higher among Indigenous population compared to non-Indigenous population, and these same patterns observed in both years 2023 and 2024 too.